All right. Welcome, friends, colleagues, students, citizens of the world. It's your boy, Leroy Horton. And I am here with another episode of the Teach Me Implants podcast. Super stoked, super excited because I got none other than Dr. Dina. And she goes by Dr. Dina because her last name is El Did I say that right?
Yes, you
Or
did.
close
That was
enough?
really
Or close
good.
enough? And for those of us that come from or have origins from other places with longer names, like my middle name is Dimitrios, right? But Leroy is obviously, or Leroy, like everybody calls me. It's a lot easier. So you go by Dr. Dina,
Yeah.
and you are probably one of the most interesting doctors that I have met recently
Wow.
because of your insight, because of everything that you're doing with your Dr. Dina platform. And I couldn't wait to get you on because the last time we had a conversation was so good. I was, hating myself for not having recorded most of that. So I was like, you know what? I got to get on the episode because this is a very, very insightful young doctor. Dr. Dina Albasiuni, welcome to the Teach Me
Thank
Implants
you.
podcast.
And thank you for such high praise. It means a lot coming from you. So
Oh,
I
thank you.
really appreciate it. I'm really honored to be on here, and I'm so excited. You're right. Our conversation was really good, and I felt like we could talk for hours.
Absolutely. And now that I've set the bar this high for you to be amazing on this show,
Oh,
right? I told everybody you are amazing. You got it's a lot of pressure to live up to. And tell anybody listening, a little bit about yourself and how'd you get to who Dr. Dina is today.
yeah. So I went to University of Washington Dental School, which is actually where I met you the first time. I think you were an affiliate faculty at that point, and I was still, big-eyed, waiting to graduate and get a DDS behind my name. And then I graduated in 2021. So we're kind of coming up to 5 years of me being out of dental school, which is really
Mm.
wild to think. I think I need to stop saying I'm a new grad at this point. I gotta give that up for other people. Um, but it's been great. And one of my favorite things has been connecting with people that want to get into dental school, people in dental school, new grads, and just helping them out because it's a long journey and it's quite confusing if you don't have good mentors. And it makes no sense that we're not there to support each other and constantly having to reinvent the wheel when it's already there. So I've been trying to make sure that I'm providing as much of the information that I can for those out there to make it a little bit easier. And that's where I started my platform. So I started on Instagram and TikTok, just making videos about the dental school application process, what they look for, how to do better on the DAT. Once you get into dental school, how can we make that easier? Study tips, study guides, all of that. And that's, I think, how we reconnected recently.
Absolutely. And so we reconnected at a Hispanic Dental Association CE that I was giving and that you were attending along with Dr. Alan Lopez and some others. And as we had a conversation since then, um, we did talk a little bit about your platform and just real quick, where can they find you on Instagram and TikTok? What are your handles?
So Dr. Dina underscore DDS. That's the same for
Okay.
both of them.
Okay. And you give a lot of tips on because as you're on my algorithm. Okay. And so I when I have someone that I really like, I do watch their videos when they pop up. Right. And
Thank
I
you.
try
I
to I try to
appreciate
like
it.
the videos. But you're giving a lot of good information. I was looking at the information coming from Medea, and it talked about like what motivates students to start pursuing dentistry. Personal experience typically is the highest one, right? You're talking 30-40% of students think of dentistry because of their trips to the dentist. And there's maybe about 30% or so that have a family member in healthcare or in dentistry, right? Kids of dentists, nieces and nephews of dentists, and so forth. Now, who exactly are you talking to? Are you talking to the students that don't have that potential in-house like guidance and support, or is it kind of the first geners like me and you who once we decided it was kind of on our own to figure out how the system here works?
That's exactly it. For me, when I was applying, I think I told you in our last conversation, my dad's side are all engineers and my mom's side are all lawyers. So
Mm,
no one's in healthcare at all. So when I came and said, I want to be a dentist, they're like, great, you're on your own, figure it out. And I mean, I didn't really have too many mentors trying to apply. So when I decided I wanted to do it, I didn't even know how to apply to dental school. I didn't know what AdSAS was. I didn't know how to get there. So my first step was just joining a pre-dental club at UW. And then when I joined that club, that's when they were like, "Oh, you use this and this is what we do and we're going to bring in the dean of admissions to talk." So that's how I started to know actually how to apply. And I want to make sure that information is a lot more accessible to people that are interested in dentistry. And I want to make sure that they feel that they have a support system out there and people that they can reach out to.
okay. How many, if any, are you at the point of your career where you started taking on mentees and guiding them through the process of like application, kind of informal one-on-one guidance?
Yeah, actually. I started from my second year out. So, and a lot of it is quite more informal.
Hmm.
People that have primarily reached out to me that maybe I know or they have heard of me from a friend or something like that. And, we've worked together. I've had them shadow me in the office a couple times. We've worked on their personal statement. We've worked on their interview skills, and a couple of them have gotten into dental school, which is always
Right.
great. Yeah. So now it's like that second journey of where I'm at right now. It's like, okay, you're in dental school. How are we going to make sure you do good? What study guides do you need? What information is confusing that we need to clarify? Dental anatomy is like dumped at you right away. So that's one of the things that I'm working on right now. How do we simplify and condense the information we learn in dental anatomy and have good summaries of it? So stay tuned for something very soon in that regard. And then when I started on TikTok and Instagram with my videos, I've actually had quite a few people reach out and have uh, just very specific questions in their regards of their application process, or they have had me edit their personal statements a couple times. So I've worked on a couple of them who have applied in the last cycle and are now going through interviews and all of that and acceptances. So it's
You
been
know,
great.
that's what's up. And let me ask you, because as I've been doing this for years, and I, like you, started soon out of graduating, or even while I was in dental school, trying to mentor the next cohort each year, right? Um, and I was a lot of students that were drawn to me tend to be students of color. Now, there's good data on 3 to 4% of dentists in the U.S. being black, 6 to 7% being Hispanic. When you look at enrollments, current day enrollments, I think it's like 5% are black, 6 or 7% Hispanic, I think it's like 21% Asian. There's not a lot of data on either Muslim students, Arab students, or Middle East identifying students, however that's categorized on a worksheet. Do you find that maybe you get a lot of the female students that wear hijabs that are drawn to you because you look like them? You probably come with certain experiences that speaks to them, and not to say that that's all you're looking for, to pigeonhole you, but have you experienced that there's a subset of students that seem maybe excited to reach out and connect with someone of your particular background?
I would say definitely. It's not that they make up the whole population that has reached out to me, but they have definitely made up a good amount. And I think exactly like you said, when you see someone who looks like you, who has a similar background or family dynamic as you, and they made it to a place that you want to reach, it gives you that hope and potential that you can do the same. And I think that is another thing that pushed me into starting my platform is looking at a lot of the dental content out. A lot of it is very, very similar demographics. And a lot of it is, and I think we talked about this a little bit, it's more of the day in the life or putting such a glamour on what it is like after you graduate, but it's not really addressing the educational portion of, well, how do I even get there?
Hmm.
Right? How do I apply? How do I get in? I'm in. It's stressful. It's exhausting. I'm getting 4 hours of sleep. Is this normal? So those are the things that I want to make sure I'm bringing the realistic view
Mm.
and showing both the good and the bad, and then working to make sure that we're helping you reach your goals at the end.
So what does that look like? Because when I look at these day in the lives, everyone gets up at 5 a.m. They put on their Lululemons. They go to Orange Theory and get their workout on, right? And then the day is just glamorous, right? They're working on a model. There's a picture of them from afar working on a patient, and then they're having drinks at the local pub or something. And so if I was young and impressionable and didn't have that guidance, I would think that dental school was actually more than anything else fun, enjoyable, luxurious, glamorous.
100%.
Right?
Yeah, you're getting your 9 hours of sleep and you're
Yeah,
eating good and you only got
right.
lectures for 3 hours a day.
Seriously. So please tell anyone that's listening, what was your experience like in dental school? And obviously you've had successes because you've graduated and you're an amazing provider now, but I'm sure there was struggles in general, daily routines, volume of work, all that kind of stuff. What was your experience in its kind of more real sense?
Oof, that's a good question. It's a loaded question too. But, I went straight into dental school from undergrad. I didn't take a
Mhm.
break. I was, hard-headed. I have goals and I'm going to reach them and go in right away. And I got burned out by quarter one. Yeah, quarter one, I was like, "What am I doing?" Um, and it's a lot of new stuff. It's you're first of all, you're taking out a ton of loans. So
Mhm.
you're for me, it was kind of a shocker the amount of loans that I'm taking. So that I got a little bit depressed in the beginning looking at the amount that I was taking out and just thinking
Mm.
that I'm gonna have to repay this and this is what the interest rate is and everything. So after quarter one, I decided I need to set some boundaries and I need to figure out how I'm actually going to survive the next 4 years because where I'm at, if I'm burned out from quarter one, it's not realistic for me to be able to go through the rest of the school. So one of the things that I did is I decided I'm not looking at my loans till I graduate. And it works for some people, it doesn't work for everybody. So if it does for you, that's totally fine. For me, I'm in a situation where I need these loans. I'm taking them, just the bare minimum that I need to be able to pay and survive and all of that. And there's nothing I can do until I graduate. So there's no reason for me to look at them. So that's going to go on my and like the back burner.
Okay.
And then I had to learn how to reorganize my life and my structure and how I'm studying. And that's something that I'm working with a couple of dental students right now that are in their first year. Not every method of studying works for everybody, right? So people study in different ways, people understand stuff in different ways. And I what my problem was is I was trying to do everything that everybody was doing,
Mm.
trying to take notes in class and I was trying to record the lectures, then go back and listen to them. And then if someone's having a study session, I want to go to that and then I want to study on my own. And it's not realistic. And that's why I was getting burned out. So I had to take a step back and just say, whoa, okay, what works for me and what doesn't? I don't care to re-listen to the lectures. It wasn't helpful. So I was like, okay, cutting that out. Writing notes was easier for me than typing. So I had to figure out, do I want to just take an iPad and write on that, or do I want to type some notes in lecture and then write my notes afterwards? So not to I loved my dental school experience, right? It's great. And I have very, very fond memories of it. A lot of it was relearning how I needed to structure my life and realizing that this is something serious. It's a grad program, it's a 4-year program, and you graduate and you get these letters with your name and you're carrying a lot of responsibility. So I needed to make sure that I was taking it seriously.
Okay. And I'm in academia now and I got dental students. And I see that same phenomenon where you have these students who they may have been high achievers their whole life. They may have been successful high achievers, right?
Mhm.
Pretty decent, if not top grades in high school, same thing through college. And all of a sudden you're hit with volume, right? Everybody assumes that, oh, what I did in undergrad, I'll just I'll just do that here and I'll be successful because I've always been smart, right? When you see these students have moments where they feel lost, where they say, I'm trying everything, I'm studying as much as I can. I've never gotten a C or a D or failed an exam before. And you start seeing that confidence crumble and that self belief crumble. How do you take someone and develop a personalized strategy for studying?
So one, failure does not identify you. It's a rigorous program, and you're not going to be able to get, I mean, maybe someone out there is, maybe it was you, but for me, I did not get an A in every single quiz and exam I took, right? And like you said, you're hit with an immense volume where at some points you have a minimum of one quiz a day and then one or two exams during that week in addition to all those quizzes. So realistically, you're not going to be able to study as much as you want for every single one of those and pass, and every single one of those with flying numbers and letters. But going back to figuring out how we're going to study, one, you need to figure out what courses you're better at and what courses need more time. And that's going to vary from person to person. Someone might be really, really good in certain subjects and need a lot more time in others. For others, it's vice versa. So you need to figure that out because you need a personalized plan that's going to work for you. You don't need to be following what other people are doing. So what I tell these students is first, it's okay if you got a bad grade. It's okay if you need to remediate an exam or a quiz or a practical once you get to practicals. It's almost a rite of passage in
Mm.
dentistry for you to have to remediate at least once, right? I mean, you teach in academia. Would you agree that that's
100%.
right?
100%.
So take that, accept it, learn from it, and move on first. Don't be dwelling over the fact that you may have failed something. Second, figure out what it is that we need to work on more, we need to study more, and what we don't need to be studying as much. And that is going to determine the trajectory of how you're going to be studying and how much time you're going to be spending on each one of those subjects. Um, and like I said before, it's no two people are going to study in the same manner. So if there is something that works better for you, you need to prioritize that and you need to make sure that's what you're doing. You don't need to be going to all of the study sessions that other people are doing if they're not beneficial to you. Now, if it is, that's great. But other than that, you need to be focusing on yourself.
Right. Okay. So you do this for 4 years. You are obviously successful because you got the title, you got the letters after your name.
We made it out. There's
You
light at
made it
the
out. We can trauma bond over that, for ages. Given that though, it's 4 years of a rigorous program. There's written boards, there's clinical boards. In that 4 years, you graduate and you're stomping the streets now. And this is where I really wanted to go with you because I felt your insight was fascinating. As a new grad, did you feel that those 4 years prepared you to be an amazing dentist day one? Right? Your license drops in late July and August. Boom, you hit the clinic floor and you're amazing. What was it like stepping into the beginnings of your career with whatever expectations you had, what desires you had for how you wanted to practice? How did life hit you at that transition period?
Oh, amazing.
Yeah.
Uh, Actually, can I tell a little story?
Absolutely.
Relate it back to dentistry.
Yeah.
I am starting to get into snowboarding. Started 2 winters ago, and my friends and I decided, you know what, let's take a class. So all of us with our gear that we bought and everything, and we go down to Snoqualmie and we decide we're gonna take or actually, yeah, I think it was Snoqualmie. We decide we're gonna take a class there. It's a 1 hour class. The instructor meets us at the bunny hills that all of the 4-year-olds are on, right? And then we're grown adults. And you walk up the hill, you strap in the board, and while you're literally just standing where you're at, he starts going, okay, this is how you stand. You need to bend your knees. If you're going to fall, this is how you fall, step by step, all that stuff. And then he goes, okay, now let's try these bunny hills. So we're going down the bunny hills. Like you fall, you get up, all of that. For me, I was trying to not hit a 4-year-old because I was like, I'm going to get sued by the parents. But um, you do this for a while and it feels like you're doing it forever. It feels like it's been days of you practicing when in reality it's like just an hour. And after the hour, he's like, great, we're going to go onto the lift. We're going to go on a real hill and you're going to go down. And I'm going up to this lift and I'm telling the guy, I don't even know how to get on. Like, you need to slow down, whatever. This lift is moving because I don't know how to sit down. We make it on. I'm panicking, sweating. We get all the way to the top and you have to you get off, right? You have to just kind of jump off and slide down. And I don't know how to get off. So I'm yelling at this guy at the top as well. I'm like, hey, I don't know how to get off. You need to slow this down. You need to stop it, whatever you're doing. He doesn't listen to me.
Hmm.
So I get to the top. I'm trying to get off and I fall. And my friend falls next to me and we stop the entire lift. And I look at him, I'm like, I told you I'm gonna fall, right? I told you. But we get to the top and now I'm trying to go down this hill that I don't know how, but it's the only way out. I have to figure it out. And that to me, when I was thinking about it, is exactly how dental school felt like
Mm.
and graduating, where dental school teaches you the ABCs. It teaches you this is a cavity, this is a filling, this is a crown, but all of the real lessons that you learn, all the real skills that you learn, you actually learn after dental school.
Mm.
So for me, I felt like dental school, it's giving you all of the basic foundations that you
Right.
can build a house with, but nothing else, where all of that is what comes from the real life clinical experiences.
Okay.
And the first few years out of dental school for me were and I think of it as like exponential growth. That first 6 months out of dental school, that first year, 2, 3, and then after a while it's like, okay, now I learn and now I know a good amount of skills that I need to about my day to day. Let
Mm.
me expand on my toolbox, right? So that's where you're learning more clinical skills or new procedures and stuff like that. But that was the biggest, correlation trying to snowboard, and I'm like, "That was dental school for me." Got out and I'm like, "What am I doing?" Like, I know how to hold a handpiece. I know what a 330 is.
I appreciate the what would it be allegory or the metaphor because I think people don't realize they feel like after your 4 years you're coming out fully competent, and I always tell people that no, you come out basically competent, right? That is your 4 years. After your 4 years, hopefully for most of us, will be the worst we'll ever be as an actual doc, right? Because like you said, your learning just exponentially grows after that. And especially you say you're coming up on the 5 year mark. So you're coming up on that 10,000 hour mark, right? If you're working full time is roughly around 2,000 hours a year. So 5 years in most professions is typically that 10,000 hour, milestone or landmark where you kind of are the expert that the titles inferred you were 5 years ago when you graduated. But
Mhm. Yeah.
someone like you is still dedicated to learning. And I know you've expressed to me, but I want you to express on here what is your philosophy that you carry with you when it comes to, I graduated to know I'm done? Or is there something more when it comes to learning after your 4 years?
So, like I said, when you're graduating, the lessons or the skills that you learn, honestly, there's so many different categories, and learning the clinical skills where you're taking CE courses and learning more procedures and everything, that's just one section of the skills that you learn. Um, Patient communication and interactions is an entire different section. Leadership, being a dentist, you're leading, depending on what clinic you're in, you're leading a whole entire team. Understanding how that works, that's a different one. So there's so many different categories, and in a sense, the clinical skills that you're learning, where you're trying to learn more procedures, is it to me was almost the easier one. You do I love taking CE courses. It's just incredible to not only learn something new, but to get to know other dentists, other people in your field, people that might have a lot more experience than you. You learn so much from them and you build such incredible friendships and bonds. So that to me is something that from year one, I graduated. I'm like, all right, what classes am I taking? Where am I going? Where am I traveling? Um, and I'll continue to do that. I will always continue to do that. But the big skills that you learn are the ones where you're not really, really trained on in dental school.
Mm. And what do those look like?
Let's see. So one of them, patient communication. I mean, the amount of or communication in general, but just how you address patients, right? for when we're in clinic in dental school, you're seeing 2 patients a day if you're lucky and no one cancels.
Right.
And that's only 3rd and 4th year, right? And then each one of them, you're there with that poor person for 3, 4 hours doing 2 fillings. When you graduate, that's not the case. You're seeing so many patients a day, and you need to learn well, let's actually take a step back. You need to learn you need to learn time management. You're going from seeing 2 patients a day to all of a sudden you have at least your 1 column that's all your own, and then you have your own hygiene checks. Maybe you have 2 columns if you grow a little bit, and you need to learn how to be bouncing from operatory to operatory. And that to me was one of the biggest things that I had to really quickly learn how to do. I can't be sitting in the same operatory for 2, 3 hours. So that's a huge thing that you have to learn, time management. You have to learn, speed. You have to get faster at what you're doing. And then we get into patient communication. Patients, when they're coming to you, being in a dental chair is quite vulnerable. You're sitting there, you're laying down, you're opening your mouth. Patients want to have trust and a bond with who they're seeing. So if they don't trust you, if they don't like you, they're not sitting in your chair. So you have to learn how to break that boundary. You have to learn how to make sure that they feel comfortable telling you, "I don't floss every day," and that you're not
Right.
gonna judge them.
Right.
And that takes time. And I think another thing I learned is you don't lie to your patients,
Hmm.
you know? You gotta be honest. If there's something that you don't know, just say, "I don't know." Say, "That's a great question. Let me go figure out what the answer is and get back to you." And they're gonna appreciate that so much more than you trying to throw some random BS at them. They're gonna see right through that.
Now, are you at the point in your career where you're still giving 1,000 options, or are you a bit more assertive and confident in kind of narrowing the path? Because I used to have a lot of associates, and especially when they were new grads, it'd be the world of like 10 treatment plans for every patient because they wanted to give the patient the autonomy of choosing, right? But at the end of the day, you realize, and I've been obviously having been a patient in different scenarios. If you're the expert, I want your opinion. What's the best one? I may not be qualified to say, well, do I want zirconia or do I want Emax or do I want PFM or you know what I mean? Where's your evolution been in your certainty? Now, when you're at the point, I assume you look at the X-rays, you look at the patient, 80% of your treatment plan is already formed in your head, and then you're fine tuning it. What does that look like for you right now? Are you still indecisive, or are you more driving patients down a road that you are secure with?
No, absolutely the second one, but I was definitely with the first one when I first graduated.
Right.
100%. When you said that, I was like, "Oh my god, he saw my treatment plans." But you're right, it's literally all about patient autonomy. It's like you care about this patient, so you're like, "Okay, well, I wanna make sure they're comfortable, I wanna make sure they're happy." Every single patient that came in, you're like, "Okay, well, we can do this, and we can do that, and then you can do that," and then they're just sitting there like, "I don't know.
Right.
What's the difference? Why would I do this, and why would I not do that?" So, I had to learn to, bring that in. You're right, they are looking for your expert opinion, and part of growing as a dentist is being able to confidently say what is going to be best. Now, you can still give patients alternative options, which, I'm sure you agree with, but it's in a very, very select way, and you're not bombarding them with different options altogether. If you have a patient who's missing a tooth and then they come in and you're like, "Okay, well, we can do an implant, or we can do a bridge, or we can do a flipper, or you can live with it." And then you're like, "And these are the pros and cons of every single one of them." You're not leaving that day. You're literally gonna be in clinic till 7 p.m., and they're probably not gonna do anything at then.
And your front desk will hate you because now they have to price out with the insurance 5 different plans, and utilization amounts and all that. But that's interesting that you say that. I was looking at the IDEA report on how many students graduate feeling confident that they're ready versus applying for advanced training. But every year we got about 20,000 dental students applying to GPRs or AEGDs. I was surprised by this number. About 14,000 students a year applying to oral surgery. Okay.
Wow.
About 12,000 to orthodontics, 9 to 10,000 to pediatric dentistry, 7,000 and some change to endo. about 4,300 to perio, which to me, if I want to toot my own horn, that means we are the select few of the few.
Was that how you yeah, I saw it as when? What you were saying all of them, and I'm like, Perio's not coming up.
It is not. No, I was surprised. When I researched it, there's about 9,000, just under 9,000 active oral surgeons in the U.S. and about 5,500 active periodontists. I would have thought it would have been the other way around,
Mm,
right? So
yeah.
I'm just going to take that as perio's harder to get into, and hence the more, if we put them on a scale, but that's my bias
What is
speaking.
that what it is?
Yeah. But so people say they feel confident graduating, but that number of people that say they feel confident to enter into practice does not jive with how many people are applying to advanced training. And I know you said you've been a CE junkie and you love going to CE. If you didn't have to worry about money or anything like that, would an advanced training, whether it's in general dentistry, like a GPR, AGD, or one of the other specialties, would have been something that looking back now you wish you would have done? Or are you still happy with the trajectory of working full time and then finding and paying for continued training on your free time?
I think part of it actually has to do with the fact that I went to dental school right after undergrad. And like I said, I did get really, really tired and burned out early. My biggest recommendation to people that are applying into dental school is take a freaking gap year. Take one, take two, learn, work, travel, enjoy life. Dental school will always be there. You're going to get in, you're going to graduate, you're going to be a doctor. So just enjoy the journey. Part of it is enjoying the journey. It's not just making it out at the end. So if I were to go back, I would start from there. I would probably take a gap year, then go into dental school. And I think after that, I don't believe I would have been as burnt out as I was. So the idea of doing an advanced residency I would have been more incentivizing and enticing. I graduated in 2021, so we were one of the fun batches that got affected by COVID.
Mm.
We weren't the main batch, fortunately. 2020 grads, I feel like, had it tougher. But our class, we had quite a big divide of the number of people that were going into a GPR and AGD, which was really surprising compared to other years. I think our class was a third went into practice, a third went into GP or an AGD, and a third went into different specialties, which is quite a significant, right? It's quite significant. And for me, part of it was there's no way I'm applying and interviewing anywhere else right now. I'm working on my resume. I'm gonna find a good associateship, and fortunately, I think it worked really well for me because I did have a really good first job as an associate. And I learned a lot on that job. And I did sort of like a mini residency where it was the AGD program. So it was a year-long program where we met 3 days a month. So it was quite rigorous and intense, and it had a lot to do with implants and surgery, and it was very, very eye-opening, and I'm very fortunate and blessed to have taken it very early on in my career because it helped when you learn the right foundations from the beginning, it helps you through instead of trying to fix bad habits that you have or when you didn't learn something in the best way, if that makes sense.
No, absolutely. And I get excited when I give CE courses and someone in the audience is very interactive. And I don't know if you remember, within that 2 hours that we spent with the group, I kept having to come back to you, right? You seem to be, you seem to be the most knowledgeable. You're definitely the most
I
expressive.
wouldn't say that, but
You seem to, you were the most expressive. You had insight. And because I work on the postdoc level education quite a bit, I feel like I have a good eye for seeing someone that I feel would also make a good specialist, right? And so I think I told you I'm gonna pressure you eventually to apply to something perio, pros, or something more advanced because you ever have a conversation with someone and you're like, okay, they're basic, and not basic in a bad way, but they're basic. And then you have conversations with people, you're like, all right, they're a cut above, and that's the type of person that I enjoy having conversations with, right? Because there's a level of insight and thinking and being able to and take all this information and comprehensively put it together. And I say all that not just to butter you up because you're the guest on the episode, but because I want to ask you a very intentional question. And hopefully you have the ability to be honest. I deal with students all the time that come to me and they want to go to dental school, but they got low GPAs, low DAT score. I deal with doctors all the time that may express a want to go into specialty, but in my dealings with them, you just feel like their ceiling is a little lower than others, right? Like when I talked to Dr. Dina, her ceiling was pretty high. So I'm like, yeah, if she wanted to go to specialty, I'll write the letter, right? And
Let's go.
there's, but there's, how do you communicate with someone, especially let's say your pre-dental students, and you're looking at them and you see the passion, the drive, the desire is there, but the execution isn't. And how do you bring those two together if they are expressing they want it, but in the arena where they can demonstrate that they want it, they don't seem to either want to or be able to? How do you deal with that scenario?
So people that they have a desire to go into dentistry, but they are not acting upon it.
As far as low grades, low DAT, low initiative to rectify that or remedy that?
So if it's low grades, I think it's different than low drive, if I can divide that up.
Okay.
If that's okay.
Yeah.
Because low grades, but if for some reason you academically are struggling a lot, but I'm seeing that you really, really are putting in the time and the effort, then to me, that's still a good student because your biggest competition when I talk to them is yourself. So I'm seeing that you're putting in the effort. It might be addressed in a wrong manner. So we might have to just shift your gears, shift your direction and your focus a little bit. How can we make all of the time and the effort that you're actually and dedication that you're putting in worth it? Where is it going wrong and how do we fix that? So to me, that's still a person that I'm willing to really, really work with and put in the time in order to help out. My concern or what I struggle with more are those individuals that don't have the drive because, and maybe you might relate to this, but coming from an immigrant family, you need to put in double the effort,
Mm-hmm.
right? There is no bare minimum happening. You're doing as much as you can and then some because that's expected of you. So that was my mentality in high school, undergrad, grad, and afterwards. I am always going to make sure I'm putting as much as I can. So when I see someone not have the drive, it's really hard for me to relate and want to put in more effort when you yourself are not putting in effort.
Mm-hmm.
So students that they just say, "Yeah, I want to go in. Hey, what should I do?" And I'm like, "Okay, well, what have you done? Have you shadowed? No. Have you assisted, gotten a job? No. Have you joined a pre-dental club? No. Have you looked for any of that? No." So it's not like, "Okay, well, why am I going to help you?" You need to be able to help yourself first, and I need to see that you're putting in the effort for me to put in the effort. But if I'm just going to be pouring into your cup over and over and over, but your cup has a hole and you don't care and all of that water is spewing out, I'm wasting my own resources and effort and time that I could be allocating to someone else that really, really wants it. So
Yeah.
with those students, I have a really serious conversation where I tell them that I need to see you willing to put in the effort and then I'm willing to put in the effort.
Right.
And it's a tough conversation. And it's not fun. And I don't think a lot of people like to have those confrontational conversations, but it's and I tell people this all the time. If you're going into dentistry because someone's telling you to go into dentistry, you're not going to make it through. The
Right.
only way to make it out of dental school and to be a good provider is if you really have the passion and the drive and you're willing to put in the effort.
I'm glad you said that, and I want to put a little bit more nuance to that, maybe, and get your insight on it. So, one of the things that I come across, especially with students of color, is they're very tied to groups of service, where they do a lot of volunteering, a lot of outreach with the different groups on campus, and then they have a low GPA. And that conversation of, well, listen, like clearly you have the time because you're putting in all these hours doing outreach, and yeah, volunteering feels good. You get that immediate gratification. But if what you want to be as a doctor, you do have to dedicate or reapportion your time to your craft. And in undergrad, your craft is your prerequisite classes and your undergraduate degree. And I've had enough students where they say, oh, my counselor said that, I'll never be a doctor or I'll never be a dentist. And when I was younger, I believed that that's how it was said to them. As I've gotten older and I've been on the other end of it where I'm telling a student, like, hey, like, you've got a 2.2 GPA. I see you doing all this other stuff. Like, it's not realistic that you're going to get into dental school with this type of performance or that you even do well if you got in. That's
Mhm.
just the data says that. And then to hear it back to me years later where they told someone that I said, you'll never make it. And I was like, that is not what I said.
Yeah.
Do you see students having a problem reapportioning or with their time allocation? So they're driven, they're in the pre-dental club, they're in the volunteer club, they're doing all that stuff, but where it really matters, they're not allocating enough time.
Yeah. All the time. All the time. And similar to the situations that you were saying that you've seen, a lot of times once they reach that level where they're like, okay, well, I already have a 2.2. How much is it going to really matter if I actually try in my next classes? It's not going to raise my GPA that much. So it's almost like they succumb to the situation that they're in, or they just don't care anymore in that situation, in that. And you're right, they're not going to get into dental school with that. There are some exceptions. So
Hmm.
I'm going to bite my tongue for a second and say there are exceptions where people have gone into dental school with very low GPAs, and they've worked on a ton of other stuff on their application, right, to make themselves stand out more, whether it's hours or their essay or extracurricular activities. But that is a very, very select few. GPA is definitely one of the first things that some schools look at, and some schools actually have a minimum requirement where if you don't have that GPA, they're not even looking at your application. And for those students, the honest reality is you need to sit down with your transcripts and you need to see what classes did I not do good in and do I need to retake them?
Hmm.
And a lot of times the answer is yes. If you failed one of the chemistry classes, you're not moving on to the next chemistry class or OChem or biochem. You need to go back and make sure you're taking care of that. They all build on top of each other. And it can be really frustrating for a lot of people. And especially if it was a class that was really, really hard, but you picked a career that's hard. You're picking a career where people are going to be coming to you and asking you for your expertise and wanting you to make them feel better. A lot of times they're coming to you in pain. It's not a joke. So
Right.
you need to make sure that you're taking yourself seriously. And if it means retaking classes in order to increase your GPA, then that's what it's gonna take.
Right. And I think a lot of pre-dents don't realize that however hard your classes were in your last 2 years of college, your upper division courses, many of the dental school courses, especially first and second year, are harder than that.
Yeah.
So
Oh,
if,
yeah.
if you couldn't do that, all right, now
Oh,
that you're in, how are you going to do this?
a hundred
Right?
a 100%. Yeah. No, absolutely. Oh my god, to do Gen Chem instead of one of the classes we did in bio in dental school. But again, like I said, you're picking a tough career.
Hmm.
So I don't sugarcoat it when I talk to students. It's if you are you up for it or are you not? And you know what? To be honest, for some, it's a conversation to have at that point, because if it's not something you're willing to put in the effort into, then hey, at least you're on the side of the fence, right? Like you haven't had to go through all of the application process. You didn't have to do the interviews. You don't have any loans, and maybe you want to shift gears.
Yeah. Yeah. And so being that you're a CE junkie now, a self-proclaimed CE junkie,
Yes.
what are some of your favorite CEs topics that you enjoy? What's your favorite area of learning right now that you're good enough to be able to say, hey, I'm a pretty kick-ass general dentist with bread and butter dentistry. I want to add some seasoning to this with some more advanced treatments. What's your go-to right now?
So my go-to is I need to halt on the amount that I'm taking. I sign up for way too many. No, but for seriously though, I really enjoy surgery. So once you start in dentistry once you graduate, you kind of start figuring out what you like and what you don't like. And that's pretty soon after that you're like, oh, I don't want to do this procedure anymore. I'm referring out. And I think that's actually another skill that you learn. It's what are you comfortable with? What are you not comfortable with? And when do you need to refer stuff out? So that was a
Mm,
lesson that I learned. I'm gonna be very humble and and say, "I learned it, and now I know what needs to be referred out, what's not in my toolbox." And I think actually that helps. This is a little bit of a side tangent, but it helps with patient confidence a lot because if you would you agree?
absolutely. Absolutely. Yeah.
If you tell
Yeah.
a patient, like, "Hey, listen, this procedure, I'm actually gonna refer you to someone that I really trust because I know you're going to be taken care of really, really well over there, and I know that they're gonna do a better job there. This procedure, we're really good at, I'm very confident in, I know you're actually gonna be in great hands getting it taken care of with me." Then they trust you, then they're like, "Oh, okay. I'm gonna go to this person," or, "Oh, okay, I'm gonna do this one in office with them." Um so that was something that I definitely learned. But going back to the original question, I have been really enjoying surgery. So a lot of the classes that I'm taking right now are relating to implants. That was the continuum that I took with the WAGD for a year and extractions, PRF. PRF is incredible. So
Mhm.
it was kind of something that I got introduced to in my first job, and then with the residency, we talked a lot about it, and we got to practice that a couple times, and, I mean, it's something that I've seen such incredible healing with.
Right. Right. So I take it you're gonna be at the PNDC this year?
I hope so.
Okay, because I am teaching a course on PRF, so you definitely don't wanna
Are
miss
you?
that.
At
Yeah.
the PNDC?
Yeah, so I'm doing 2 courses. One's on PRF, I think one's on bone grafting, and then we're doing a debate, me and a fellow periodontist. We're gonna be, showing a borderline case that could go either way, and I'm gonna be debating why we should do this, and she's gonna be debating why we should do that, and then the audience votes on who wins, so it should be pretty fun.
Cool.
But we also have this year, if you're into surgery, the AAP, the American Academy of Periodontics, is going to be in Seattle, and so is the American Academy of Oral and Maxillofacial Surgery. And I'm always been a big proponent of going to some of these meetings that are not necessarily your particular lane,
Mhm.
because you see not only advanced stuff, but you also see different perspectives than courses that are designed just for general dentists, right?
Mhm. Yeah.
And I'll be at the AAP, so
Excellent.
be nice to see you there. So I do have a question because we're coming up on almost an hour, so that's how
Wow.
fun it is talking to you because time flies by. But this is a little bit more sensitive question. I have been with a number of friends of mine talking lately about what's going on social media with doctors. And I know you have a history family coming from Egypt. You wear a hijab, so I'm assuming there's a cultural and religious desire for modesty to some extent, right?
Mhm. Mhm.
And this phenomenon of grown men and women, and I think it's more so disheartening when I see women do this, that have gone through undergrad, potential socioeconomic challenges, doctoral programs, residencies, and they're essentially having to spread their message via dancing on TikTok. And I mean, and it's not always like necessarily a inappropriate dance per se. Some of it is. Some of these doctors are twerking on TikTok, right? But some of them, it's just a dance, and there's like words that pop up, and as they're dancing, they're pointing at the words, and I don't know why it bothers me so much, but I almost feel sad for them that after all these years and all these accomplishments and affirming their abilities and expertise, we're in an age where they're relegated to dancing to send a message. Am I just old and so divorced from this generation and that's just the best way to spread a message? Or is there any validity to my sadness when I see a 40-plus-year-old woman who's so successful and so brilliant, and she literally has to do a dance to be seen and heard on a public platform?
You know, I'm gonna start by saying I actually am so impressed by their confidence level.
Mm,
'Cause just the videos that I've been doing are very, very recent, right? I've only been doing it for a couple, months now? And oh my God, it's so awkward to talk to yourself. I don't know if you feel that, but like it's not even, you're not even just looking at your phone screen, you're looking at the camera on your phone.
Mhm.
And then you're talking to nobody. Like, I love this because I'm talking to somebody. Like, we're talking, we have a back and forth. When I'm recording my videos, I'm in my room and I just on my desk and I'm trying to look at a camera and I keep looking off screen. And so, and that's just making videos sitting down. So, people
Mhm.
that are making videos standing and dancing, I mean, I don't know how many retakes they do,
Right.
but and that's like a lighthearted,
Yeah. Yeah.
light heart of the situation. But it's very interesting. I definitely do see a lot of what you see as well. And it's I want to be very mindful and I want everyone to use their platform in whichever way they want. I think a big part for me is who are you trying to reach with your messages? And what message are you trying to send? Like, because you were saying, they rely on dancing to send their message. So what is their message? And who's their audience? Because for me, my message and my audience is education and those that are willing to learn. And I'm hoping to expand it to people that are not dentists as well, right? Like if we're talking about making short videos for just the general public and regular patients of what is periodontitis versus gingivitis, or what's a bridge, what's an implant, what's the difference, pros and cons. So a lot of my content is more based on I want to make dentistry more accessible and easy, and
Mhm.
questions that you may not be comfortable asking your mentor or your professor or your dentist even. I want you to know you have a bestie in dentistry, that's what I call it, and just someone that you can reach out to and ask questions. I think the biggest part is people's focuses are different. So some people, it's reaching enormous numbers of audience, and it's just about reaching certain numbers. For me, it's quality over quantity. The people that I'm reaching are people that they're either trying to learn more about dentistry, they're trying to get into dentistry, they're in dentistry and want to know what the next step is. And my future goal, my priority is I want to create a platform and a a community where people from undergrad that are still trying to get into dentistry all the way to new grads know that they can come and connect and get their questions answered. So for now, a lot of my videos are primarily in that demographic. I'm hoping to expand videos and talk more about just general dental topics that maybe an average person that's just a patient at a dental office is too uncomfortable or scared to ask their dentist. So, for example, what's gingivitis? What's periodontitis? What's the difference between an implant versus a bridge? Do I really need my wisdom teeth taken out? Those are videos that I want to do. So, a lot of my information is just more, let's break down dentistry so that there is no barrier. A lot of times I feel like there is a barrier when you're talking to your provider or just even reaching out to a person that has more expertise than you. So I call it your bestie in dentistry. That's the goal
Okay.
that I'm trying to send. So
That's cute. I like
I
that.
struggle enough to look at a camera. I'm not going to be dancing in front of the camera.
Yeah, I appreciate your insight on that. I think part of it for me is a generational divide. Because I don't even see it and look down on it as in like I don't approve of what you're doing, in my yard. It's really just I feel saddened, but maybe that's just something that's kind of inherent to me. I think I don't know, maybe it's a longing for like maintaining a respectability, Like I wouldn't want to see my doctor twerking on a video. And mind you, what you do in your personal time, everybody is a human being. So I'm sure everybody goes to the club, everybody, or whatever their version of like social gatherings where they are going to be human. But I think when you come, and on their personal page, I don't care what anyone does. But if you're pushing a public professional persona, and I don't see any cases, I don't see any expertise, I don't see, but what I see is you in high heels. And a lot of the guys, it's like them jumping into their Porsche or jumping into like it's all about kind of flash and professionalness, and
Mhm.
that's just the old guy with the gray beard talking about. the next generation.
No,
Yeah.
you're absolutely right, and I think internet dentistry is scary,
Mm,
and if you get pulled into thinking that's what the reality of dentistry is, you're in for a shock because nobody has 100% perfect days, and you don't drive that car right out of dental school, and, you're not sitting looking picture perfect in the office, and then you get up and you start dancing either.
right.
The reality is a lot of times you're stressed, you're sweating, for me, my hijab's, like, lopsided. I come in looking good, I look at myself in the mirror when I'm leaving, and I'm like, "What's going on?" Um, your car, you're still driving the same car because you still got loans to pay or,
Mhm.
you prioritize where you're allocating your money at this for certain times. So it's if you think you're gonna graduate and you're gonna go into that right away, it's a shock, and a lot of it right now is just the media hype and people just coming in on that. Um and again, like, everyone's platform's different, everyone's focus and what message they're trying to send and the audience that they're trying to reach are different. I'm just hoping that I'm reaching the audience that I want to reach, you
Right.
know?
Right. Well, I'm sure you are, and I'm sure you're doing it with poise and grace and a lot of insight from what I've
I
seen.
tried doing those, like, voice recording ones where, like, it's an audio and then you try to mimic the audio.
Right.
Imma get you to
Right.
do one with me.
Let's do it. I'm down.
Next time I see you, we're doing a TikTok together.
Let's do it. Well, Dr. Dina, Dr. Albesuni, if I said that correctly,
Yes, you did.
or correctly enough. I appreciate your time and your expertise. I want to have you back on because now that we've done the intro and we've kind of laid the groundwork, I feel like doing something a little bit more nerdy and academic would be fun. And
I love
that's something we can prepare for. Thank you so, so much. I will make sure that in the show notes on YouTube and Spotify and Apple Podcast, I'll put your TikTok and your Instagram handles. So anyone out here that's looking to get into dental school, Dr. Dina is your guide for that. And then for any of you, especially your new grads, Dr. Dina's got a lot of advice for you if you reach out to her regarding post grad life when you're officially a DDS, DMD.
absolutely, on the other side of the tunnel. Y'all are gonna
Absolutely.
make it through.
Well, thank you so much, and to all my listeners, my parting words: keep reading, keep listening, keep learning, and we'll talk to you soon.
Thank you for having me on, this has been great.
Absolutely, thank you.